Good evening and welcome to a special hour-long live event this World Cancer Day. My name is Olive Burrows, and this evening we shall be delving into some specific areas, being cancer registries, data and research in Kenya. And with me in studio we have Dr. Elias Meli, a consultant and clinical oncologist. So when I googled the definition of oncologist, cancer treatment without invasive surgery. Did I get it right?
Correct.
All right. And importantly, he is the CEO, acting CEO of the National Cancer Institute of Kenya. We have Anne Korir in studio. She is an epidemiologist. So I read that has to do with research around public health. Yes. And she specializes where cancer is concerned. In fact, when I was on your LinkedIn, I also saw you are the pioneer of the cancer registry. And I saw there was the Nairobi registry, and there's one in Eldoret?
Yes.
Okay, are those the only two?
Those are the main ones.
Those are the main ones.
But we have others, yes.
All right, so we'll get more into that in the course of this hour. We also have in studio Dr. Job Nyangena, and he tells me, and he has informed me, that there is a specialty known as digital medicine?
Digital health.
Digital health, okay, yeah. Digital health. And he is head division of health informatics and Director Digital Health Informatics Policy and Research at the Ministry of Health. An important voice to have at the table. We also have joining us virtually, and that is Dr. Edith Koba, and she is a consultant psychiatrist and is a lung cancer patient. Edith, thank you for joining us this evening. Again, a very important voice needed in this conversation. Now, to give some context, in Kenya, cancer is the third leading cause of death after communicable and cardiovascular diseases. And according to the International Agency for Research on Cancer, as of 2022, there are 44,726 new cases of cancer. This you advise us on why this is the case, but 16,000 of the cases are male and 28,000 are female. I have an idea, but you're the expert in this subject. Okay. Then 5-year prevalent cases are 102,152. So you'll explain to us what that means, the prevalence and why 5 years. And in both sexes, the top 3 leading cancers are breast, cervical, and prostate cancer. And but when it comes to ranked by death, cervical cancer is actually leading. So cervical, followed by breast cancer. And the third, I had to Google the correct pronunciation of this word, esophagus. Esophagus is the third. And yeah, so this Cancer Day, the World Health Organization has called on countries to strengthen information systems to gather quality data for decision making. And that is why our focus this evening is cancer registries, data, and research in Kenya. So there's a theme that has run through 2022 to 2024, that is closing the cancer gap. And then the sub-theme for this year is together, working together, and then specifically calling governments to account in terms of how much money goes into health and also technology and all of that. And we'll get into that in the course of this conversation. But Dr. Meli, I see you in a white shirt and a white cap. Did you have an event today, being World Cancer Day?
Yeah, of course. Thank you, Olive, for having us this evening at NTV. We are grateful that we have an opportunity to share with Kenyans why today it's important, you know, as a day that we are marking and commemorating World Cancer Day globally, every 4th of February. It is a very important day because we are creating advocacy, you know, across the world on matters cancer across the entire, you know, care, from prevention all the way, you know, to early detection through screening, proper diagnosis, treatment, survivorship, and even palliative care, as well as rehabilitation. So we are happy we have an opportunity to discuss with, you know, our viewers tonight and those who are listening to us, so that they can understand why they need to take care of themselves, how they should do it, and what resources are available. And today we really want to focus on, you know, cancer registries and also data and cancer research. The National Cancer Institute of Kenya is an agency under Ministry of Health, which was established in 2012. And lately, it has taken its strategic role in providing leadership and governance in cancer care. And we have one mandate, cancer prevention and control. And today, being World Cancer Day, it could not pass without, our heavy presence on the ground and also in media. Today, we had World Cancer Day celebrations in Eldoret with the Eldoret Cancer community. And we brought together, all the stakeholders in cancer care, from academia, from private sector, from Ministry of Health, philanthropists, individuals, and all those people who care. And we had a very beautiful day. We had a walk across Eldoret town in the streets, and finally had a meeting that we also spoke to media and discussed why it's important to work together. Remember, WHO is calling on us to work together, so that we can address this challenge that it is really, you've just mentioned about data, you've discussed about statistics. It's worrying. If you compare GlobalCan data 2020 and 2022, what you just read, it is very clear the burden is rising. So the National Cancer Institute of Kenya is a strategy that this country, put in place to reduce the burden of cancer by deploying many different interventions. And one of them is what we are discussing today.
Okay. All right. So because you mentioned data, and the lady who is responsible for the cancer registry in Kenya is here with us. And perhaps you could explain to us what a registry is. Let's start there.
Okay. Thank you, Olive, and thank you for this opportunity. So a cancer registry is a system. It's an information system that deals with the collection, the processing, and the analysis of data so that you can use it to make informed decisions. So once we collect the data, we are able to process that data. We aggregate the data from various facilities, and then we are able to interpret it after we analyze it. And this is why you're able to read the statistics that you've just read about the cancers that are common in our country, the cancers that are affecting our people. We are able to tell this through the cancer registry because we systematically collect this data over time, put it together in a system so that then we are able to analyze and we are able to know what is this data telling us. We're able to use it to inform decision making. We're able to use it for research, for patient care. We're able to use that data to plan and prioritize so that then we can be able to allocate resources accordingly. So that is, in a nutshell, what a cancer registry is.
All right. So you told us we have two main ones.
So we have the Nairobi Cancer Registry, which is based at Kemri, where I am. And we have Eldoret Cancer Registry that is based at Moi University. So these two registries, they're over, I'd say over 20 years old since they were established. And they have largely generated the statistics that we're able to use in our country. We utilize this data locally, and it's also utilized by WHO to generate the statistics for Kenya. So through these two registries, we're able to generate estimates that you've just read through GlobalCan. We just got a release just a few days ago for the 2022 incidence, mortality, and prevalence data for Kenya and also globally. So, so these two registries are largely what we currently have. But of course, we've put in place interventions to really expand this work. We've done a lot of trainings across the counties. We've been able to establish additional registries in some counties like Kisumu, Meru, Nakuru. We've had capacity building across many of these counties so that we can also establish new registries that then can give us even the geographical variations. Because what we see in Nairobi may be different from what we have in Garissa, may be different from what we have in Mombasa. So we need to establish more of these registries so that then we can be able to understand the burden across the country and understand the different cancers that are affecting our communities in the country. Yes.
Olive, allow me to add that we have two different types of registries. We have a population-based registry, and the Nairobi and Eldoret are population-based registries. But at the National Cancer Institute of Kenya, we are the custodian of the National Cancer Registry, One of our functions at the National Cancer Institute of Kenya is certification, inspection, certification, and designation of cancer treatment centers. And the law that established NCI, the Cancer Prevention and Control Act, provides for all these facilities to notify the National Cancer Institute of Kenya of the patients, data of the patients they are treating. So this is called hospital-based cancer registry. And Anne has talked about population-based registries. So we are able to provide data for all the patients who are treated in all the public and private hospitals in this country. And we are using that data for the reasons which Dr. Anne Korir has mentioned.
Both of you have preempted my next questions, because my next questions are going to be, one, how comprehensive are these registries? And I was going to ask, where do you source the data? Is it public health facilities? You've told us for the national registry, public and private health facilities. When he says population-based, what does he mean? Is it like census officials who go out?
Okay, so population-based essentially just mean a defined population. So the population becomes our interest. We are interested to know, where do these patients live? Where do they spend most of their time? Because as we collect this data, we want to also know why these cancers are occurring. So could there be things in the environment that are predisposing these cancers from occurring? So when we talk about population-based, and this is something that is advised by WHO, to really understand what is happening in the population. So currently, the population that we are focusing on at KEMRI is Nairobi. And at Moi University, they are focusing on Uasin Gishu County and Nairobi County. Okay. Because we also go by the demographics. I mean, by the, you know, what can I say? The way the country is divided, our country is divided into counties. So we go by that. But when we talk about hospital-based, then we are talking about all the facilities, irrespective of where this patient is coming from. If we pick an example of, say, Kenyatta National Hospital, they will be looking at patients who live in Nairobi, but also there are patients who've been referred from other counties who are being managed in these particular hospitals. So the population-based registry will make an effort to collect all the cases that are resident of this population. So you will be collecting from all the hospitals and any diagnostic facility, whether it is the labs, whether it is the clinics where the doctors are seeing these patients, whether it is the hospices. So you will be attempting to register every single case of cancer occurring in that population, so that then you are able to tell what is the incidence, what is the incidence rates for this cancer, what is the mortality rate, what is the survival. You're able to study, you're able to do research and do more in that population. Okay. But we also appreciate the hospital-based registries, because then they are also utilized by the hospitals to inform planning, resource allocation. They'll be able to say, oh, we have these cancers that are more prevalent. Maybe we need more oncologists. Maybe we need pediatric oncologists. So they're able to plan and utilize also this data for research and many other things. And the National Cancer Institute are now making an attempt to develop the national registry, where all the hospitals will be feeding the data into a system.
Okay. So because you have introduced systems, and we have a specialist in digital health, Dr. Job, okay, do we have such a system in place? Are we in the process of developing one?
So thanks a lot, Olive. Happy to be here. So we do have the register that they've talked about, the Nairobi one and the national one and the one in Eldoret. They're already running on systems. So the role of digital health is to facilitate sort of a national ecosystem that will facilitate information flow and to make it easier to manage these registries. So for example—
Quick question. For the national registry, is as in, do these health facilities go into an online portal and feed in this data?
Yes,
as it is.
We do have a digitized national cancer registry, and we have trained health records information officers in all these facilities that they have login credentials, and they key in data for patients from when they walk in. And I know, you'll be talking to Dr. Edith Kwaba shortly, and we would know what is the profile, what we want to enter from a patient when they walk in, from their biodata to clinical data, to investigations, to treatment plans, and even follow-up. So we have a system that exists, that they key in, they are trained, and they are able to you know, it's a system that when you key in data, it immediately reflects in our system at the national office.
Okay. So, Dr. Job, we already have a system in place.
Yeah. So the role of digital health is not just setting up these systems, but to facilitate information flow. It's information management. For example, if a patient seeks cancer care in 2 different facilities, they're going to be, those 2 different facilities are supposed to report that case to these registries that have been talked about. But if the 2 systems report the same case, but using the different identities of the patient in the different facilities, the file number or whichever other identity that is used, then this record, when it's sent to the registry, might create a duplicate. So you might have, say, you might count 1 case as 2 because it was reported from 2 different places.
Yes.
So for us is to standardize this, to provide a unique ID for the patient that can be used across the healthcare system. We're working on that. To provide a unique ID for healthcare workers, for the facilities that provide this care, so that records are linked across the healthcare system. So that if the record is captured, let's say at the Nairobi Cancer Registry, it's also captured in the national one. And we can track even other comorbidities. By comorbidities, I mean you may have cancer and you have another disease. Is this other disease a risk factor for this cancer? We need to know this, so that's why we want to set up information systems that are accurate and complete in terms of the information that they collect. So that's really our role as digital health.
Okay, interesting. So we do need to take a break, but when we come back, we will hear from Dr. Edith Koba. I apologize, but thank you for your patience that I've taken so long to come round to you, but we hear from her immediately we come back from this break. Thank you for staying with us on this World Cancer Day. We are discussing cancer registries, data and research in Kenya, but at the heart of it all is the patient. And we have joining us virtually from Eldoret, Dr. Edith Koba, a consultant psychiatrist and a lung cancer patient. Of what significance, I'm curious, Dr. Edith, does this day hold, given what you're going through now? Because it's more than just, because sometimes when you look at statistics, you forget that this represents a person.
Thank you so much, Olive, for having me here, and Dr. Mary for inviting me on a very short notice. But when Dr. Mary talked to me, I said, yes, I'll come. I don't know what I want to say, but I believe that I represent them. It's very easy to talk about World Cancer Day and sometimes to imagine about them, whoever they are. But for everyone, especially who is going through this journey, to know that it's us, it's not just about them. We are real, we are human, we are people's daughters, we are professionals. And it has nothing to do with anything probably that we did. And I think just to give people hope. So for me, one of the reasons why I'm excited, I'm a psychiatrist. I've always talked about World Mental Health Day. And for me, this is special to be here, not as Dr. Edith Koba, but as a patient, because a lot of times it has always been you on the other side talking about medicine and what it means to be a patient and encouraging people, but then to be it and to be working in this, I'm truly grateful for everyone who's organized this, because really what you're saying is that we too are important and that you can't do this without us. And as we talk about data and research, remember data is about collecting information about many objects, and those objects are me, it's us, and to know that we are real. So I think it's very, very important, first of all, that such a discussion involves a patient, because especially for those people who may have lost hope because of what they are going through, then they're able to identify and realize, oh, it actually affects real people, and that someone is doing something about it. So that is not just hopeless. And I think even as we talk about data and research, the hope is that what comes out of this discussion is not really to be academic and talk about numbers, is that we'll create hope by you can't get resources if you don't know how many people actually are suffering. And many people are also hiding maybe their identities or not accepting that they have cancer. because they don't want, because of the stigma that's around it. But when we involve patients like myself and people can say it's real, people can come out of it and they can say you are coming out of it so that you can let people know that it's true, we are suffering, and we can let the government know that these are real human beings and that they can invest in it. So very important topic for me as a patient. Of course, I don't represent, a lot of times when people talk about World Mental Health Day or World TB Day, they're talking about people who've had a lot of experience. I'll say I'm a raw patient. I'm still mourning my diagnosis. But thinking about this day and thinking that we can actually sit to reflect about it and give each other hope, then gives me reason to be here. And one of the things that I actually woke up today and crafted a message and say, you know what? It's not because we did anything to be here, but now that we are here, we have to keep hope alive and we have to keep going because it's not over until it's over. And we have to keep encouraging each other. So I'm excited to be here more to encourage myself and to encourage others like me who are going through this journey, because it takes all of us, Dr. Melly, epidemiologists, the information people, and us as patients to accept that this is it. Cancer is real, accepts real people, but together there are things we can do to make a difference. So for me, it's about hope and working together to create hope in each of us. Thank you.
And indeed, there is hope, Dr. Edith. Just this last week, I hosted a cancer survivor. She suffered from cervical cancer and had by the name of Zipporah Salama. And she was saying how at the time in 2019, when she was going through cervical cancer, she could not access radiology services in Mombasa, although she says now there is one facility there. So she had to travel all the way to Nairobi for those services. So do you think, and I'm guessing in the treatment, sometimes there are referrals, right? Because there are different specialties, like you said, it's sort of like you need different expertise depending on what stage you're in and what you're dealing with. So would it be beneficial to have like a unique identifier, such as Dr. Job has talked about, such that if you're going for a test or you go to a different health facility, you don't have to start describing the state of, your condition from scratch? That they can just look it up online.
Oh yes, Oli. So I can imagine, and I know you have seen this with survivors of illnesses, and it's not very easy to keep telling your story. It's a very sad story. I laugh because I laugh sometimes because probably I'm a mental health expert and I've talked to myself, people have talked to me, but it's very sad to keep saying what I felt the first time and what the journey has been so far and the pains I've gone through. But imagine if I showed up, currently I work in Eldoret, but sometimes I have to seek help in Nairobi. But I imagine there's someone who's coming from Turkana, who is having to come to Eldoret. And you can imagine the pain of having to explain what they have to go through. And in hospitals, we are said to ask questions like police officers, and you ask, who are you? When you allow information that says, oh, this is Edith and she's from Eldoret, and I can see the diagnosis, I can even see the treatment she has been on. And all I'm doing is simply, instead of bringing back the pain, is saying, oh, and you have been on this medication and this is what you needed and here we are. So I believe that it's very important that if I showed up in whatever hospital I showed up, someone is able to identify with what I've been going through and to quickly be able to pick information without spending the next 1 hour trying to understand who I am and me having to recount the pain. So I believe it's very important that we have this data. We also have research, because there's a lot, I can tell you, that still has to be done to understand what we need to do to make sure that the pain is well controlled, the cancers don't progress, and all these difficulties that we have to go through. So yes, I believe that it's very important we have data that at the click of a computer or even a phone, now we have phone and internet all over, someone is able to get all this information in one go without having to ask so many questions.
All right. Dr. Melly, so in terms of research that she's referenced, right, Dr. Edith, how important is having this data?
Well, thank you, Olive. And I want to really thank Edith Kwaba for accepting to speak to the nation and even those who are watching abroad, about our experience. Thank you very much, Edith. We pray for you, and we trust that, God is going to come through for you, as we also take care of you as the medical fraternity, in Eldoret and across the country where she's seeking care. Let me just add before I answer your question. This current government is very serious about digitization and digitalization. And in Ministry of Health, there is now a digital superhighway. And it is important in the context of what we were discussing that really, as an oncologist sitting in the clinic and asking a question to a patient who has come to see me after seeing 5 oncologists, it's really painful. You are reminding them, but if we're able to click in a computer and be able to pull out data of a colleague who was in Kisumu and be able to refer to it and just pick it up from there, it makes it easier even for patients as they get care from different providers, because taking care of a patient who is diagnosed with cancer would bring together more than 10 experts. There's a pathologist, there's a radiologist, it could be a physician at some point, there is an oncologist, there is a nurse, there is a social worker, there is a psychologist, we have people who are entering data, who are in data science. So there are many people who interact with these patients. So it's important that we really capture this data in a digitized manner, and we're going to use it for efficiency. Let me mention that data is quite important. For one, we can use it, as Anne mentioned, we can use it for national planning. Even at this point when we are discussing about universal health coverage, where cancer is covered in there, without data, we cannot make any, decisions at the strategic level, because this is what guides, Ministry of Health and the government on why we should deploy particular resources and how much resources. So for cancer, where I have been championing, while even developing the regulations, social benefits packages, for primary healthcare fund, for the new healthcare financing, the social health authority that we are asking everybody to embrace, we have put our voice there to make sure our patients, using data, we have realized that our patients are not going for screening. But we know the hope of winning this battle against cancer is prevention. Having community health promoters are going to help us to preach the prevention messages. Having them to advise every homestead to go for screening, and having them to advise them to go for HPV vaccination and other, cancers that can be prevented through vaccination. We want to collect all that data. Then we will know, because currently we are doing poorly, and this is data that has informed us. If we have our screening for cervical cancer at 33%, when WHO is asking us to go to 70%, it is data that is informing us. Okay. Number 2, research is very important. In our country currently...
I want us to take a break for the news highlights, and then we'll come back with a question on research. All right, so let's take a break, but when we come back, we look at the import of this data and what areas of research are there. And WHO has made certain recommendations. For example, when cervical cancer, leading cause of death, where cancer is concerned, they're talking about HPV DNA. You are a specialist. You will tell us if you agree that it is superior to the pap smear, to the acetic acid, and all of that on the other side of this break. All right, welcome back. We're discussing cancer registries, data and research in Kenya on this World Cancer Day. Dr. Meli, I cut you short when you were addressing research. And when I was on your website, and when I say website, I mean the National Cancer Institute of Kenya website, I saw mention of this strategy that you've just handed over to be the National Cancer Control Strategy of 2023 to 2027. And I saw that research was a big part of that.
Correct. Thank you, Olive. Just like the government has a plan, National Cancer Institute of Kenya also has a plan to address this challenge, because this is the roadmap that guides what we are going to do in the next 5 years to make sure we address this dragon that is ahead of us. And We are committed, and we trust that we will get adequate resources to implement it to the latter. And research is one of the components. We have 5 pillars here, you know, and quickly we have prevention and early detection. We have pathology, imaging, and laboratory medicine for diagnosis. We have treatment section with survivorship and palliative care. We have advocacy, partnerships, and healthcare financing. And then we have cancer registration. We have cancer surveillance, and we have cancer research, you know, among the 5 pillars. That is the summary of all this. It is a 49 billion cost strategy for the next 5 years. We are trusting that for us to address this issue, we have to implement the latter. Cancer research is very important because this is where we get to know who we are and why do we exist and what do we need to do. This is where our questions will be answered, even from basic surveys, without even going to the complicated research of genomics and DNAs and proteomics, you know, the complicated and technicalities of cancer research. We just want to understand very basic things in our country. You know, we are currently relying on Globocan data. We are relying on, you know, and this data has a lot of mathematical prediction that we calculate, but we want to get our raw data locally analyzed. And that is why we are going big through the National Cancer Institute of Kenya to make sure that we have the right data for our people so that we can use it for planning. I mentioned earlier on, it will guide to know, do we need radiotherapy centers in Kisii? Do we need in Machakos or Kitui? Do we need in Busia? You know, what other diagnostics, what other interventions? And then most importantly, if we want to dissect the quality of care that we provide, we must get to know our data, because this is where we will get to know how are our patients responding to treatments. For a long time, the protocols that we are using, which we refer to as evidence-based protocols in this country to diagnose or treat patients, is developed from foreign data. And you know, genetically we are different. Cancer begins from, you know, a mutation in our DNA. And our DNA is different from Caucasians, it's different from Asians. It is even different between, you know, West Africa and East Africa. And it's even further different between Western Kenya and Northern Kenya. It is further different even amongst people in one county. So we really need to make sure that we conduct our local research, we generate our local data, and we analyze and we disseminate. For example, we know the HPV vaccine. Now we are going, there is likely to be a policy shift from the two doses to one dose. And Kenya participated in that study. We did in that study, you know.
That it showed that the efficacy is the same, didn't
it's the same,
as the
you know,
2 or 3 doses.
Yes, and while discussing with our counties, because currently we are also helping county governments to develop each county cancer action plan. And we are asking this question, how is your HPV uptake and coverage? And they are struggling. And if you ask them, how is the uptake for the first dose? They are happy to mention that the first dose, the uptake is quite high, but second dose, it's very poor. So getting one vaccine will be very important. So it is really important that we consider research. We have capacity now. We have our human resource. There are many scientists now, both in clinical and basic sciences, who can conduct research in our country. We have infrastructure. We just need to fix a little bit, you know, small quality issues, and we should be good to go.
All right. Do you agree with Anne? Do you agree with Dr. Bali? What are some of, now we are saying way forward, what we need to do to get things right, to move better, to be strategic. What are some of the challenges you encounter accessing this raw data?
Yeah, so there are many challenges, Olive, as we do this cancer registration work. First of all, a lot of the facilities are still maintaining manual systems. We still have paper-based systems. So basically, a patient goes to the hospital and they open a file, a physical file, where they put in paper and they record the information on paper. And you find that as this patient comes back for care, some hospitals are able to maintain one file and be able to just have continuity of that. But in some hospitals, you find that when the patient comes back, they open a new file. So they do not know what the patient was put on the previous visit when they were last in the hospital. So there's no continuity of care. So basically, the data is in various places, different filing areas, and then there's no consistency, and following up this patient then becomes a challenge. And this is why we are embracing the digital system so that we can solve some of these challenges. You also find that even as we collect this information, the registries, we really need to institutionalize some of them. Like, for example, the registry in Moi University needs a lot of support in terms of human resource, right? So it's labor intensive because we have to go peruse through patient files to be able to collect this information. So there's a lot of human resource capital that is required. The systems are still paper-based. We need to be able to improve those systems and make them more digital. So there's a lot of challenges that go into collecting this data. Another challenge also is maybe with our clinicians, because some of the information may not be documented clearly. For example, something like stage of cancer, the staging information. If it is missing, then we will not be able to know at what stage are patients being diagnosed in our country. So if we want to do research to improve the staging, and yet you come to the cancer registry and it's missing on stage information, then we are not able to make progress and to do more research to understand why are our patients being diagnosed late. So I'm also urging the clinicians and the doctors who are generating this information. Basic data like age, right? If you write adult, then how will we interpret that data? Some of our systems cannot even analyze that. If it's missing a symbol variable like age, if it's missing a symbol variable like place of residence, right? I want to understand, where are these people, where do they live? I want to know whether there are some clusters that could inform the causation of this cancer. But if it's missing that residence, then I'm not able to analyze that data. So again, just urging everybody who is generating this data, the clinicians, the nurses, anybody who is involved in generating this data, to really be deliberate in documenting this information. Because eventually when it goes to the cancer registry and we put it all together, then it becomes meaningful. We are able to use that data to make informed decisions. Yes.
All right. So there's something Dr. Melly said, Dr. Job, and he talked about this administration is keen on digitization. So the president spoke the other day and said the community health promoters have been equipped with devices so that they don't need to walk around with files and papers and things like that. But in terms of health information exchange, there are privacy concerns, are there not?
Yeah. So digital health is one of the 4 pillars of the universal health coverage that the current government is trying to ambitiously implement. And in digital health, there are a few things that we're working on. Number one is the Digital Health Act that really sort of provides the legislation, the legislative framework to facilitate the work that we're doing. Number 2, we're working on a health data governance framework that will basically give us a framework on how to handle health data, because it's sensitive data, even according to the Data Protection Act. And then last year, during the launch of Kenya, the e-citizen platform, our minister, the Cabinet Secretary for Health, presented the digital health vision for the country. That's the Kenya Digital Health Superhighway, which is a platform that will facilitate information flow across the healthcare system. So earlier in this interview, Dr. Edith Koba talked about how difficult it is for a patient to keep repeating their story every time they go to a facility. Anne here has talked about the fact that patients in different, the same patient can have different files in different facilities. We are trying to move away from that by providing a single digital longitudinal record that's going to be, covered by this data governance framework, cybersecurity, and all these protective measures, so that regardless of where the data is collected, it's going to be available in any other place based on the patient consent. So we're working on all these things, and we're hoping in the next few months we shall have something to sensitize the public on.
All right. We are hopeful. And Dr. Edith, since Dr. Job has brought you back into the conversation, speaking from the perspective of a patient, and I know you said this is a fairly new diagnosis and you're still coming to terms with it. For those just joining us, Dr. Edith is a lung cancer patient. What would you like Dr. Melly and Dr. Job to have in mind as they leave this studio?
I think the most important thing is that we need to keep remembering that cancer patients are not just cancer patients, they're human. And the most important thing is to keep giving them hope And we are glad that we're having this conversation, because then we know that what they are doing is trying to put efforts to make sure that there's a lot of investment in cancer care. And I happen to be a doctor myself, and where I come from, where I work, you find that patients travel from very, very far. And we are glad that we are talking about data, because data then is going to help us know how big is the burden. We are going to do research, and we are going to get enough information to ensure that the government, because that's what we expect Dr. Melly and everyone else to keep doing, invest, so that a mother in Turkana does not have to travel all the way. Sometimes they don't even have food to travel to eat, to travel to Eldoret, for example, to seek care. So what we want the government and everyone who's involved in this to do is to make sure that we are reporting enough as patients, we are accepting, so that we can give this information, so that they know that how many we are. And at the end of the day, that as we invest in malaria, in maternal child and everything else, we ensure that we have enough information, enough research to ensure that this care can go to the people as close to where they are as possible. Because I feel very privileged that I'm able to access care, but I know many people cannot access care because they don't even have the basics and they don't have enough support system. So we want them to invest in drugs, we want them to invest in emotional support and all the social support systems that patients need to keep hope, because it's very tough to have a diagnosis of cancer, but it's worse to know that there's nothing that can be done about it. But that we're having this conversation, for me, and I want to encourage all of us who are going through, we have to keep accepting, and we have to keep what we have to keep doing to ensure that as we pray, as we seek all this other care, we also take medication and do everything else we can do to keep going. Because tough as it is, it's what it is, and equating it to a plane that is
All right, Dr. Edith, sorry about that. The network connection seems to be a bit unstable, but thank you. I think we've gotten the gist of what she's trying to say. So, Dr. Melly, in less than a minute, your last word this evening.
Well, thank you for having us. I want to thank NTV. Thank you, Olive, for hosting us tonight. The game changer here is standardization. We have to standardize our care across all levels, you know, from prevention to screening to diagnosis, you know, to treatment. And for us to be ready to conduct quality research, we must work on protocols. We must work on guidelines. They are available in this country. There are those we've developed locally, and there are those we can adopt, which are regional or international, which are scientifically driven. And this is the agenda National Cancer Institute of Kenya is pushing right now, to make sure all our comprehensive cancer treatment centers, and also the other centers which are middle level and basic centers that are designated, are able to take care of patients using standardized protocols. When we speak the same language, this is where now we can join, you know, countries that have matured in conducting research. And we are asking our doctors, we are asking our healthcare providers across board to adopt these protocols. Let us have the discussion, and together we are being called during this World Cancer Day to work together as teams in closing the care gap. And we are being called to ask government, you know, and even philanthropies, people in private sector, to invest more resources in cancer care. And we shall champion for that. Lastly, we have launched a call for cancer research, which is funded by the National Cancer Institute of Kenya. So I'm inviting scientists to look at our website. They will find the call, and they will find all the documents. The call lasts 1 month. Let them apply. We are ready to facilitate them to conduct local useful cancer research. Thank you, Olive.
All right, thank you very much. I want to thank my panelists this evening. I don't know whether we've lost Dr. Edith Koba, but she was joining us from Eldoret, and she is a consultant psychiatrist and a lung cancer patient. Thank you for joining us this evening, Edith. I want to thank ladies first, and Corinne, and she is an epidemiologist She's also Senior Research Scientist and Head of the Nairobi Cancer Registry. Thank you for being here this evening. Dr. Job Nyangena, who is Head Division of Health Informatics and Director Digital Health Informatics Policy and Research at the Ministry of Health. Thank you for being here this evening. And last but definitely not least, Dr. Elias Meli, a consultant clinical oncologist and acting CEO, National Cancer Institute of Kenya. And thank you. Stay tuned for NTV Tonight, the news coming up.